If you go into any hospital room and look around, I'm going to bet there are more than a dozen medical devices that are connected to the network. Everything from the infusion pump to the TV to the bed itself is now capable of sending telemetry and information to other systems inside the hospital. There's a term for all these connected devices, the Internet of Medical Things, or IoMT. It's the healthcare version of IoT, the Internet of Things, which we've been hearing about in mainstream media for years. The number of connected medical devices is about to skyrocket. According to the latest analysis by Data Bridge Marketing Research, the IoMT market was about $48.7 billion US in 2021, and it's going to jump to an eye-popping $270 billion US by 2029. That is phenomenal growth. Now, managing this IoMT growth is going to be a challenge for IT teams across the country. But the good news is that there are technologies, policies, and procedures that can be put into place now to make things smoother. Hello and welcome to Healthcare IT Today, where we explore the latest news, interesting stories, and technology trends in health IT. I'm Colin Hung, and today I am joined by Sameer Khanna, Chief Security Strategist at NETSCOUT. I'm excited to talk to Sameer about the explosion in IoMT that's about to happen and what we can do today to manage it better. Sameer, welcome to the program. So Sameer, it's so great to have you on the program today. Welcome.
Thank you. It's great to be here. Thanks for inviting me.
Sameer, let me start by asking you this. Over the past several years, we've been hearing a lot about the growth of the number of connected medical devices in hospitals. Everything from infusion pumps, oxygen machines, beds are even now capable of being connected to the network and sending telemetry back to the central systems. Has NETSCOUT seen this growth in connected devices through your work with healthcare organizations?
Yeah, absolutely. I mean, this is exactly what all healthcare organizations are talking about these days. And when you think about some of the benefits that IoMT provides, for both patients and providers, it makes perfect sense. And I mean, of course, these are anecdotal stats, but much of this is backed by a tremendous amount of research that's done already on the web and tons of articles and things that are out there that speak to the projections of the market size, for IoMT and connected devices, period. Going forward. So yeah, absolutely. Top of mind for all healthcare organizations.
Well, and it's just, it's a function of, these smarter devices are designed to help improve the patient experience and make everything safer, right? So, I mean, it's natural that we would want more of these devices inside the healthcare organizations. And there's a whole term, as you just mentioned, that refers to these devices, and it's the Internet of Medical Things, or IoMT, right? It's sort of the healthcare version of IoT that we hear about in the press a lot. And actually, given the fact that NETSCOUT works with so many other industries, and IoT is sort of a little bit more further along in those other industries, are there any sort of best practices that you think healthcare should adopt when it looks at IoMT?
Yeah, I think that's a great question. I think it's universally, it's tempting to say that if you track, scan, and segment every single device that you own effectively, your problems are solved. But obviously, it's not that easy, right? Unfortunately, in the IoMT world, I think it's a much more harder problem to solve, right? Because when you think of IoMT, it's a lot heterogeneous mix of devices scattered all over the places, right? You've got tons of new devices being added on a regular basis. So it's a much more difficult problem to solve. Now, having said that, there are certain parallels that you can draw between what other industries are doing and what healthcare can adopt as well. And I would say developing a very good understanding of, number one, how many devices every single organization has and what they specifically do. So specifically their environmental specifics, as in who do these devices talk to? How often do they communicate? What are they talking about? Really getting a sense for the behavior of these devices. It really serves as a good foundation to start developing the best practices for these devices.
You just spoke about something that's, not so easy, right? A, getting inventory, and B, finding out what other systems this device talks to is, other than manually doing it. Like, is there any tools or anything that could be used to help discover what these devices are talking to?
Absolutely. I mean, there are tools out there, obviously, different using different types of data sets, and not all data sets that they're using are very are equal. But there are tools that are in the market that allow you to, number one, identify what device it is based on the communication from that device to and from the device. And then number two, by looking at the behavior of that particular device in the network, these tools can provide suggestions, or they can identify vulnerabilities, or they can, essentially provide information that an organization needs to do anything from protecting a device from an issue at hand to helping organizations create policies to protect these devices in the future. I mean, also help them craft policies for devices that are going to be added into their organization. So absolutely, there are tons of tools that are out there in the market that specifically do this. And obviously, NETSCOUT plays a very important role from a security and a performance management standpoint for those in that particular aspect of IoMT. Absolutely, NETSCOUT actually does have a tool, actually a set of tools that not only helps identify the performance of those particular devices, but also helps you detect all the different communications to and from devices, including vulnerable communications to vulnerable devices, anywhere in the world, and help you secure those devices. Yeah.
And once you have that map of what a device might be talking to, what do you typically look for when you have that map in front of you? Like, is there certain vulnerabilities you're looking for, or is there certain pathways you're looking for? What is it when you have that map that's so important?
Well, you're really driving at two big things. Number one is, are those devices speaking to anything that's anomalous, right? Are they speaking to something outside the organization that could potentially be attacking that device, which could be severely impactful to their organization? I mean, and that's why I talked about this takes us so high with IoMT, because patients' lives are at risk, right? We talked about infusion pumps. You hack into those devices, you could affect lives. Number two, it is all about, back to my concept of segmentation. But at the 50,000 foot view, at the 50,000 foot level, it's about helping you understand the behavior of that particular device so that you can say, okay, well, this device is meant to talk to that device on the second floor because it does X, Y, and Z every other week or every single day. But now if that device A is talking to another device on another floor that is never meant to communicate with, that's anomalous behavior for that device. Perhaps it's a problem waiting to happen. So why don't we just create a policy to prevent or block that communication that should never have been opened in the first place, so that it doesn't, the problem doesn't become systemic in nature. So those are the two big things that it helps with.
Gotcha. And I'm assuming having this all in one place to help manage things would be very helpful. I think NETSCOUT calls it single pane of glass, right? In order to have visibility. Yeah. Can you explain that and actually why that's so important?
Yeah, the single pane, that's a great point. So single pane of glass really, the crux of it is about having a bird's eye view into the user's experience. That's what it's really all about. I mean, it's centralizing access to vital information or critical information so that you can make better decisions. And the big reasons why that's really important is, number one, when there is a problem, having access to this information helps you, number one, validate that problem very quickly, and then identify the root cause to essentially help you triage. Number two, when you have access to this type of information, you can start to develop that sense for the behavior, so you can get ahead of problems and become more proactive in nature. So those are some of the biggest reasons why we are such big proponents of single pane of glass type of view of vital information.
The way you describe it, Sameer, it almost makes me think of like a nursing station and how that works, and how all the telemetry from all of the things that are monitoring the patient's vitals are being sent to the nursing station so that they can be monitored. And sometimes there's even AI looking at it and making sure that everything's in the normal, parameters. And then when something isn't, it alerts people. And then because it's in a centralized spot, it's easy to take action. Is that a similar analogy to what NETSCOUT is saying around the single pane of glass?
Yeah, I mean, that's exactly it. You hit the nail on the head. It is all about, in essence, it's about centralizing access to curated data so you can make better decisions. Now, in the NETSCOUT world, we use that data in order to improve the user experience and and the performance of the user on the app, on the network, as well as securing, their access to the network and the things that they're doing. In the healthcare organization world, it's about better patient experience. It's about, providing value-based care. It's about, ultimately saving lives. Yeah, but similar concept, absolutely.
I want to bring it back to something you said earlier. There's a lot of studies and a lot of predictions by market analysis firms that is just saying that we're basically on the cusp of an explosion of connected devices at the home, at the hospitals, anywhere where you basically get care. And that means to me a lot more potential for A, communications problems, B, performance problems, right, with so many more devices, and C, of course, you mentioned the cybersecurity risk, right? With so many more endpoints, you just increase the surface area of potential attacks and potential vulnerabilities. Should people be wary of this, or are there tools and technologies that are readily available now to help somebody manage this potential explosion?
Yeah, it's I think they already are quite wary of this. When you talk to IT and healthcare organizations, I mean, this is top of mind for that very reason, because this is obviously a much longer conversation, but I'll use my example that I talked about earlier. So, I think in your first or second question, we talked about this concept of tracking and scanning and segmented devices. You do that effectively, problem is solved, right? Again, easy to say. But in the healthcare organization, one of the reasons why it's so challenging is because, when you think about the number of vulnerabilities that are essentially projected or that are communicated by these IoMT device manufacturers, and we're talking thousands and thousands of vulnerabilities every single month, right?
Mm-hmm.
Now, the number of the ratio of the patches to solve those vulnerabilities to the number of vulnerabilities actually is very skewed. Now, I don't know what the study is, but I suspect it's like 1:100 kind of a thing. So imagine you've got one patch for every 100 vulnerabilities that are out there. So it's a real problem. It's a pretty big problem, right? Number two, they're not, healthcare organizations, especially depending on the size of the organization, obviously has, try to have as many resources to help solve these kinds of problems, but they don't have infinite resources to solve these problems. So this is why it's so critical when you think about the challenges that IoMT presents. It's really critical to sort of, think through not just from the perspective of technology, but also policies and also procedures and the organizational alignment and all of those facets. But yes, to your question earlier, what we see out there and what healthcare organizations are facing, yes, there's certainly a lot to be worried about. But there are lots of tools in the market. There's hope. And healthcare organizations are already taking the right, taking a lot of steps to essentially solve some of these challenges.
Well, and to that point, there has for a long time been clinical engineering teams, right, at hospitals that are solely responsible for the maintenance and upkeep of devices. Now, of course, we're seeing that clinical engineering and IT have to get and work much more closely in alignment, because the two do impact each other, right? Like the more devices that clinical engineering has to patch and fix and put on the network, the more IT has to put the infrastructure in to help them manage it.
Yeah, absolutely. Some of the other challenges, I'd say, like, there are three big challenges that come to my mind when we think about IoMT. Number one is inventory asset management continues to be a problem to be solved, right? Many organizations still don't have a very good grasp on how many devices they actually own, right? That's number one problem. Now, that's been in the works for quite some time, and I suspect in due time, that'll be solved. Hopefully it'll be solved. Number two, there's a lack of expertise as well, right? How do you create policies to secure devices you don't really have a very good understanding of? And finally, you hit a big one, which was a surprise to me the first time I came across it, but no longer a surprise, is that there's a massive disconnect between the teams that are responsible for procuring these devices and the teams that are actually responsible for protecting these devices. And oftentimes they're not communicating, right? So these three ultimately, I think they make the trio and of the triad of the IoMT world, I guess, in terms of challenges.
And that's a really great nugget that you brought up there. Like, and it is so true that when we look at devices in the traditional sense of a medical device, cybersecurity, ease of maintenance, you aren't usually or haven't been at the top of the priority list when hunting for a selection criteria for a device. It's much more around the clinical aspects of it and the patient's experience, which hey, those are important, no doubt. But I think as the number of devices gets larger and the vulnerabilities get greater, I think there has to be some thought given to these aspects of it, the cybersecurity and the maintenance, because if there's an equivalent device, but it's easier to maintain, it's got a much better history of cybersecurity, or they've baked in cybersecurity thinking into their device, that might be a better choice for the organization long term.
Yeah, I mean, my hope is, and again, I could call it wishful thinking, but my hope is that IT gets a seat at the table, right, when the decision making is happening about bringing these devices on board. Now, the importance of bringing these devices on board is clear. Everybody knows it. We all get it. Everyone understands it. But I think, to your point, I think if we can marry that with how do we also secure these devices from the inception of when they're being thought about being brought in, I think that right there, it creates a very dynamic, powerful doer to help solve some of the challenges in that space.
So Sameer, let me ask you this, because as we know, or as we hear, healthcare IT departments are super busy. They've got tons of other priorities, workforce challenges, revenue challenges. You just got to keep the lights on, right? And the 21st Century Cures Act with all the interoperability and the availability and the access that they now have to provide. So IoMT, let's be honest, is not super high on people's priority list. So there might be a temptation to kind of kick the can down the road and go, you know what, I'm not going to do nothing right now. We'll just deal with it later. Tell me why that might not be the best approach.
Yeah. So I think number one, that many of these medical device technology, right? I mean, IoMT specifically, these connected devices, they are heterogeneous mix. And so what you've got at play here is legacy and non-legacy devices. It's very difficult to protect. I mean, to some extent, you could make the argument that if you put standard security models around, these edge connected devices, you're covered because, by and large, you're fine. They don't have that many vulnerabilities. If they do, you're protected. But you also have a lot of legacy devices that cannot be patched regularly, and therefore they are far more vulnerable. So the standard operating models or the procedures, so to speak, don't really function very well to protect those devices. Unfortunately, the adversaries and the so-called bad guys out there, they know that, right? And they are going after those specific devices. So, one of the things that we talk about in NETSCOUT quite often from the cybersecurity perspective, and we work with very large organizations, specifically healthcare organizations, we come across things called APTs, or advanced persistent threats. Now, these are very notorious threats because they are very surgical in nature. They are very, very complex and often use multi-attack vectors, very complex scenarios. So they can certainly wreak havoc. So when we talked about like infusion pumps, right, there's obviously a danger to a patient's health and their safety. That's a big one. Right? There's a direct correlation between hacking a particular device and someone's life in the healthcare world, which is why the do nothing approach, which is why the stakes are so high, and the do nothing approach actually is, it can be questioned very, very easily. And we work with several different organizations, and one organization that went down the path has already gone down the path on ensuring they have all the inventory and asset management already done in place, and now is working towards understanding the behavior of all of these devices and leveraging NETSCOUT to develop that even further, develop those models really well, so that they can address these kinds of problems. So that if and when there is a potential attack, that's any kind of opportunistic or an APT type of a threat, they have the infrastructure already in place to be able to quickly get to it if it's happening, and then ultimately remediate it if it's somehow happening. So this is why I think it's really crucial when I talked about this concept of developing a base and foundational learning of what are these devices doing beyond just knowing what these devices are is really, really important, so that you can come up with policies to protect both your non-legacy as well as the legacy devices against all these different kinds of threats that are out there in the market.
I just want to add something there, Sameer. Again, the way you describe it, it almost to me is the same argument that people make for technical debt, right? Like if by not dealing with the problem today, you're just building that debt bigger, right? Because if you don't do your inventory, if you don't put these policies and procedures in place, and the number of IoMT devices continues to multiply, the problem just keeps getting bigger and bigger and bigger until a few years from now,
Absolutely.
you'll have a mountain to climb, as opposed to just sort of dealing with the smaller mountain now. Right? Like, is that accurate to say that there's sort of this concept of debt that if you don't deal with it today, it'll build up and make the future a little bit worse for you?
Yeah, I mean, absolutely. I mean, let's just take the market as a whole and just basic segmentation of even the IoMT market. Again, when we think of IoMT, we think technology and we think an infusion pump oftentimes, right? But just within the IoMT space, there are several segments. You've got static devices. You've also got wearable devices, right? So yeah, I mean, when you think about like me as a patient who has potentially a band that's telling me how I'm doing on a regular basis, can walk into my doctor's office and talk about, hey, I've got 17 different stats I didn't know anything about. What does these really mean and how do they correspond to my health, right? Meanwhile, the hospitals and the providers have their own set of IoMT devices that are doing 100 different things as well. So you're spot on, and they're not going anywhere. If anything, we're going to end up with a ton more. Look, that's great, right? It's great for both the patients and the providers, but obviously from an IT standpoint, it requires a tremendous amount of effort and attention.
So other than during an inventory and making sure that you have your arms around exactly what kind of devices you have deployed in your facilities, what are some other concrete steps that a CIO or an IT department can take to begin to prepare themselves for this, growing world of IoMT?
Yeah, I think first and foremost, right, just acknowledging the fact that it's a little bit of a different problem and a slightly more challenging problem because the stakes are very high, right? So it does require non-traditional methods and a holistic approach to solve this problem, which involves not just technology, because our minds just automatically gravitate to tech when we think IoT, but also processes and people and organizational alignment, right? So that's really huge. From a purely technology standpoint, you hit the first one, which is inventory asset management, right? The other part, which we talk about quite a bit at NETSCOUT, is sort of the environmental aspect of it. Really developing a base and solid understanding of the behavior of these devices, and they're actively in the network doing what they're supposed to do. And then from that, two big things come out. Number one is the ability for for organizations to protect the patient experience and the providers from any sort of vulnerabilities and attacks that might be happening in real time. Number two, to help create policies so that they can define things like who is supposed to talk to whom and who is not supposed to talk to whom, which is equally important. And then finally, from an organizational standpoint, I think, again, back to my wishful thinking, is getting a seat at the table to start to help make better decisions on how to secure these devices from the inception of when they're brought in. If not that, then at least opening up lines of communication between, the ClinTech groups, or as well as IT, and within IT, the security groups, as well as the network groups, because they all have the same charter, but for them to come together at the same table and start communicating about this will make a big difference.
Sameer, you've shared a ton of great information with us, lots of really interesting nuggets and useful practical nuggets as well for people out there listening. Where can people go to find out more information about NETSCOUT should they have more questions?
Sure, yeah. So they can go to www.netscout.com, and then there's a lot of good information, basic information about what NETSCOUT does and the industries that it plays in. But specifically in the industry section, there's actually a healthcare section where they can go into, which has a lot of good information about how we work with healthcare organizations across the world.
Well, Sameer, again, thank you so much for being on the program today. Really appreciate it.
Thank you for inviting me. This was great. Thanks a lot.
I want to thank Sameer for spending time with me today and helping me better understand the IoMT world and, more importantly, what healthcare IT teams can do about it. Implementing that single pane of glass, as he spoke, can really help people understand where the risks are and, more importantly, where those devices are sitting and who they're communicating with. If you want to find out more information, please check out the NETSCOUT website at netscout.com. And if you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening and watching this. Also, head on over to healthcareitttoday.com to access free resources, industry news, and insightful articles. You can also connect with us on social media using the hashtag HITSM. I'm Colin Hung. Thanks for being here.